2 weeks ago, I heard that one of my uncles was found unconscious. It was found out that he had suffered from heart attack. My uncle is that kind of guy where if you ever line him up with the other people of his age, you would not suspect that he has a disease. How could it happen to him? What is causing heart attack? Why we are all at risk of getting heart attack? And why is it preventable? When somebody dies of an unknown cause, it's very likely from heart attack. Heart attack happens when the arteries that supply the heart muscle is cut off completely or significantly so that the blood flow is reduced dramatically. So several decades ago, people dying of coronary artery disease or heart attack were up to their 70s. People suffering from coronary artery disease and heart attack can become younger and younger. Your chest is sewed open and the surgeon attaches that graft below the blocked arteries. So these are life-saving procedures that give us a chance to not die yet. But these procedures do not prevent another heart attack, does not prevent another coronary artery disease buildup, because they do not fix the problem. Hey Lifestyle Changers, it's Dr. Edelita, and welcome to my Sunday Drive. 2 weeks ago, I heard that one of my uncles was found unconscious. Prior to that, he was feeling unwell, I was told. He was taken to a hospital and it was found out that he had suffered from heart attack. My uncle is that kind of guy where if you ever line him up with the other people of his age, you would not suspect that he has, a disease. My uncle is not obese. His body physique is admirable, in my opinion, because he's very active, and so many could not believe that he had suffered from heart attack. How could it happen to him? Well, so today, my topic is on heart attack. That's a layman's term for acute coronary artery disease. And I'm going to explain to you what is causing heart attack, why we are all at risk of getting heart attack, and why is it preventable. So based on statistics, since it's the number one killer disease in the world, when somebody dies of an unknown cause, it's very likely from heart attack. Heart attack happens when the arteries that supply the heart muscle is cut off completely or significantly so that the blood flow is reduced dramatically. So if you can see here, left side of this picture, you'll see the longitudinal section, the right upper small box in the right upper corner. You'll see what the lining looks like in a coronary artery diseased, a diseased coronary. You notice that the lining is thickened and there's plaque buildup there. You all can also notice that the blood flow is significantly reduced, right? There's very little. It's like a door that's the door is, completely closed or just slightly open. So very few volume of blood passes through it. And so what happens is that if this is happening in this part of the artery, right? So the muscle below it, or the muscle which is supplied by that artery, suffers and it dies. Okay? So heart attack is a culmination of the disease we call coronary artery disease, or CAD. Coronary artery disease is nothing but simply a narrowing of the blood vessel due to formation of plaques, cholesterol plaques. Here you'll see a progression. This is a very nice illustration um, that shows you what the blood vessel, what the coronary artery looks like if you splice it or slice it longitudinally. So this also shows the progression or the evolution of the coronary artery disease. So let's start our story with, wow, when we are born and healthy, we have this nice thin clean lining here, a thin lining in our arteries, so the blood can freely flow in there. But what happens over time is that this thin lining gets friable and inflamed, coupled with high cholesterol levels. And this cholesterol can now, because the lining is friable from high blood pressure, uncontrolled cholesterol, uncontrolled diabetes, smoking, alcohol, unhealthy habits. This is what makes the lining friable. And when it's friable, the cholesterol can get in under, right? And now it's not supposed to be there. So what the body does is that the immune cells will, start looking after them, like, hey, you're not supposed to be there. So they chase those cholesterol plaques and then attempt to contain them. And in doing so, they start building up this plaque like a colony underneath your artery. It's like you're stacking up those stuff there, and it now pushes the wall in towards inward, like making the blood vessel narrow. See this? Now, when that happens, it will push the lining so thinly to the point that it will rupture. And once it ruptures, here you have the blood, and a clot can immediately form in seconds. And that will, furthermore clog the artery. So in heart attack, that's why I said heart attack is a culmination of a coronary artery disease. It's a culmination, right? But question you might have is like, do I have symptoms as this build up over time? Not necessarily. Many people, are walking asymptomatically, right? No pressure, no symptoms. Now, some people may already noticed increasing blood pressure over time. Of course, that makes sense. When the vessel is narrowed, the pressure inside builds up too, right? But I want you to understand that if you look at this picture, this doesn't happen overnight. This happens in years and maybe decades, which I will explain here. Because when I understood this evolution, this process, my next question in mind was, wow, so when does this plaque buildup start? If there is a slide that I want you guys to take home with you and ponder on it, it would be this one, this slide. And what really was interesting and concerning at the same time for me is that knowing that that process I just explained to you started even when the baby is still inside the womb, when you're still a baby. So several decades ago, people dying of coronary artery disease or heart attack were up to their 70s, okay? 70 years old and above, or maybe 60s, late 60s. They're old. And so we thought, heart attack, well, it just happens to older people. Well, this way of thinking changed when the study was published in 1953. What happened in 1953? Well, we know about the Korean War, right? What they did is that 300 bodies of American casualties of Korean War were autopsied, and they look at their blood vessels. And the age of these soldiers were averaging at 22 years old. And what they found is that 77% of soldiers had evidence of calcified plaque here. So this is just kind of a time evolution of the coronary artery disease, and this is the later stage. Well, the plaque, right? The cholesterol plaque buildup. Remember those cholesterol and calcium and immune cells that are, trying to contain the cholesterol underneath. This is what it is. Now, so 77% of those 300 bodies of American casualties of Korean War already have shown this plaque buildup. You know what's more concerning, guys, is that later they autopsied the bodies of accidental death victims whose age are between 3 to 26 years old. Accidental death victims. They look at their arteries, and guess what? What they found is that this age, they already showed some fatty streaks, and to as early as 10 years old. Fat streaks are already building up under the lining of the vessel or within the blood vessel lining. Fatty streaks in 10 years olds. So that kind of, if you string it, if you string these findings to the findings of those American casualties of Korean War at 22 years old, that kind of makes sense, you know? If you started already having fatty streak buildup in the lining of your arteries, 10 years old plus 12 years old, you could easily get to this stage, right? Now, the shocking truth did not stop there. Italian researchers look at inside the arteries, the blood vessels of miscarriages and premature newborns, babies that died shortly after the birth. They look at the arteries, and what they found, they already found some friable, inflamed linings of their arteries, and that they found is this was finding was more prominent in babies with mothers of high bad cholesterol. So this slide, I hope you will understand and ponder on that the coronary artery disease and heart attack, that process already starts as soon as the babies conceive. If there are underlying factors like high cholesterol, high blood pressure, high blood sugar, obesity, even just for the mother, the baby can already be affected by this condition. So now what I said concerning is that it's concerning because we are knowing that people suffering from coronary artery disease or heart attack can become younger and younger and younger. So now we're not seeing that a heart attack's just happening in 60s and 70s, but it will sooner or later be at their 50s, 40s, 30s. I've even have a patient at his 30s with heart attack. So now, a person who suffers from heart attack will undergo stenting, heart stent. I'm not sure if you guys have heard about this, but a very simple explanation of heart stent. So this is where when a catheter is inserted into your groin, right? They find a big blood vessel there, and then catheter is inserted into the groin, and then they trace it up to the heart, look for that part of the blood vessel in the heart that was, blocked, and then they're going to clean that up, clean the blood clot out, get the blood clot out, and deploy in there a stent. And a stent will push the wall outward on both sides, like an umbrella, right? It's like an umbrella. Push the wall outside so that blood flow is reestablished. That's what a heart stent is used for. So notice that even if you have the stent there already, the lining is still thickened. The plaque is still there. Now, if there are more blood vessels involved, 3 or more, usually, depending on the location of where the blockage is, your doctor may recommend a surgical invasive procedure called Coronary Artery Bypass Graft, or CABG. Right? So what does coronary artery bypass graft look like? Well, blood vessel is harvested. A healthy blood vessel is harvested here from your groin. You call that a graft. And your chest is sewed open. I mean, literally, that bone, your breastbone, is being cut midwise, and that is to open and expose the heart. And the surgeon attaches that graft below the blocked artery so that it will serve as a new bridge to reroute the blood flow from the main source to the heart muscle right here, which is deprived of blood flow because of the blockage here. So it's like, rerouting a road, when it's basically declaring this blocked coronary artery as non-passable road, and the doctor, your surgeon, will have to establish a new road for blood to flow. So let's talk a little bit about this number one killer disease. We know that if a person who is having a heart attack arrives on time in the hospital, well, he may be lucky to survive by undergoing heart stent or heart bypass. But to be clear, these procedures, not only expensive and invasive, are not, I should say, the answer and the final fix to the problem. Don't get me wrong. These procedures are life-saving procedures. Life-saving. Because again, if you're lucky, it's still indicated, because there's a very short time window for doctors to recommend this procedure to you. If you're lucky, you can be saved at that moment only. So these are life-saving procedures that give us a chance to not die yet, right? But these procedures do not prevent another heart attack, does not prevent another coronary artery disease buildup, because they do not fix the problem. It's like my patient Phil. My patient Phil had a triple heart bypass, and then, so 3 grafts, triple heart bypass, and 1 year later, he had another heart attack. What they found is that one of those 3 blood vessels, grafts, was blocked again, so they have to redo that. And then 2 years later, had another heart attack, and they had to put a heart stent in. 7 years later, another heart attack, and another stent placed in. That was on top of him suffering a stroke, and he had an underlying uncontrolled blood pressure, uncontrolled diabetes with obesity too. 80% of heart disease, stroke, diabetes, according to World Health Organization, can be prevented. And we know this to be true. Now we've shown we can reverse them. How? This is, by the way, Phil, who had suffered multiple heart attacks, right, at different times, with triple heart bypass and multiple stents. But this was his medications. And when he changed the way he eats, he changed the way he treats his body, adopted a healthy lifestyle, eating predominantly a whole food plant-based diet. Guess what? I was able to take him off all these medications in yellow. 6 blood pressure and heart medicines. And technically, he was not on any of them in just 4 months. Just aspirin and Plavix, which are blood thinners, and a small dose of cholesterol medicine. And his blood pressure had never been good. I mean, before, when he was loaded up with blood pressure meds without lifestyle change, his blood pressure was at 140/95. Now, it's just 100/70 without medication. And Phil's story is, repeatable. This is an angiogram, and here you'll see a blood vessel in the heart that's narrowed. You see the narrowing, the thinning of the artery. When I say thinning, it's by radiographic, a description, like it just becomes thin. And the diameter is supposed to be like this. But with just whole food plant-based diet and a low dose of cholesterol medicine and healthy lifestyle changes, In less than 3 years, the same person was angiogrammed and the same blood vessel. Oh, look at that. This is without heart stenting. Without heart stent. So when WHO said we can prevent, we can prevent another heart attack, we can prevent and even now reverse coronary artery disease, that is a scientific statement. We are now learning that when we adopt a healthy eating diet that is predominantly a whole food plant-based diet, increase our physical activity, avoid living a sedentary lifestyle. That's what it means, like less sitting, right? Less sitting, more movement. Develop strategies to manage stress. Avoid risky substances, right? Improve your sleep. Risky substances, by the way, we're referring most commonly used are alcohol and cigarettes, right? And then maintaining a healthy, positive relationships. These all are what the 6 pillars of lifestyle medicine tackle on. There's so much to say about what we can do because this is a very, very broad topic. But I do hope that this has awakened you in some ways and means like it doesn't matter how old you are or how young you are not free of coronary artery disease, because as I've shown to you with that slide, it starts even when you're still in the womb of your mom, especially if your mom had already underlying high blood pressure, high cholesterol, diabetes, obesity, highly inflamed body. You're growing in a highly inflamed body. Your arteries could have already started that disease. So my assumption is that we all have some degree of coronary artery disease, no matter the age, if our eating and our lifestyle habits are bad. But the good news is we know we can reverse it. We know we can. If we know how to how to take care of our bodies so that our bodies can heal, our arteries can heal. That angiogram, right, showed us, and many more. I wish I can show you more, but I will tackle that in my succeeding videos. Now, there's one slide I want you to remember, that progression, the progression, that cross-section of the artery, progression from fetal to adult, right? Fetal to teenager to adult. Please keep that in mind. I plan to focus on what's interesting to you guys and what struggles you are experiencing to help you on your journey to better health. I hope that this has been significant to you as it was for me. That's it for now, guys. Hope that you will join me and make it a Sunday routine to join me live here in Lifestyle Changers MD. That's it. Love you all. See you next week.